think the strongest aspects of what we do at the ranch at Dovetree clinically is that we have developed what I would call a developmentally appropriate program. That we have considered, especially with the collegiate population, what it looks like developmentally, where these young people are in their age and stage in life, what developmental tasks they have not really learned due to their substance use, and what we can do to go back and help build out who they are as individuals fully in terms of their recovery. So it's not just about don't drink, go to meetings. It's a lot more about who they are as individuals and how we're able to help them flourish and grow into the young people that they were meant to be before addiction stole their life. Well, I think there are a couple of reasons that the ranch has been such a success, and I think they revolve around the people that we hire very highly trained, skilled individuals to deliver the best possible clinical care that we can. We look a lot at what are best practices in the field. We look a lot at what is evidence-based practices in the field. But I think all that's important. But I think what's really important are the people. That when you deal with a very well-trained, committed clinical staff whose heart is absolutely in the game of recovery, then I think you get success. That we care about the people we treat. We try to do the best we can in terms of cutting edge clinical approaches, but the people I think have been our greatest success.
I have been here for approximately 7 years. I've seen this institution grow from approximately 28 beds to 56 beds. We've added several different services. I like the personnel that I work with. I think we have great employees. They're very passionate, very enthusiastic for the job that they do and working with the clients that we serve. It's very fulfilling to see in this environment because it is a little longer term in nature than an acute hospitalization. We have the ability to see them come from their worst and come on the backside to a place where they're very active in their recovery in many cases, and they're giving back to the community because of the recovery tools that they acquired, in this environment and also in their sober community.
What I love about my job is working with so many awesome people. The teams that I have in each department are phenomenal. I love the passion that the people that work here have, their genuineness, their ability to connect with the clients and meet them where they're at.
I think the thing I love most about getting people into treatment is it's a fresh start for them. It's like a do-over. They can start their life over. I love being in recovery. I love watching families be put back together. I love really everything about the process. That really depends on the client. We like to get them in within 3 or 4 hours after they first call. So it's not a long process. It's not drawn out. It's very simple. And they call, and we can usually admit that day. Collegiate client is a typical young adult that has not met the milestones that we think they should have met. So while we have an age range of 18 to 25, we take some 17-year-olds. But if we have a 26 or 27-year-old that is just failing at life, they can't finish school, they can't hold a job, they're not in a committed relationship, they go into the collegiate program for young adults. Typical traditional client has met those milestones. They may be married, they may have children, they have been self-supporting and living on their own, and they just have different concerns. Collegiate client, they've stunted their development, and so we want to make sure we're meeting their developmental needs while they're in treatment. While the traditional client has a whole set of different concerns. How do they go to work and stay sober? How do they relate to their wives or husbands and stay sober? And so that's really the distinguishing factor.
What's your favorite aspect of the job?
my favorite aspect of the job is providing hope when there is none. And a lot of people call and they're in crisis. They don't know where to go. They don't know what to do. And their loved one is dying and they need help. And we can talk to them and provide some hope that they haven't felt in a long time.